Hi, I'm Dominic Canzillo, and this is my presentation on emphysema, or as I like to call it, the killer cough. So starting off with a quick definition, emphysema is a form of chronic obtrusive pulmonary disease, or COPD for short, the other type of course being bronchitis. Specifically in emphysema, the alveoli are damaged. They can either lose their elasticities, holes can form so that air escapes into the lungs itself, or the alveoli become thicker and less numerous. This last one is the most common. And so when the alveoli become thicker and less numerous, there's less surface area, so gas exchange occurs less, but we'll dive into that later. Another part of emphysema is that there's problems expelling air, so breathing becomes very forced and very hard. Here's an example. So we can see the healthy alveoli looking like a nice bunch of grapes. Very clear that there's a large surface area around all these alveoli. And then we compare this to the damaged ones, and we can see that it's very shriveled. It looks like they're almost dying in a sense. And they don't expand as much, so they can't hold as much air, but also they can't contract as easily, and they lose that elasticity, as I was saying before. So do you have it? The causes of emphysema most commonly are smoking, especially with chronic or COPDs in general. Smoking contributes to 90% of them. Other causes of emphysema, however, is getting anything in your lungs. A common example is working with asbestos, and then there are additional risk factors you see below: low body weight, secondhand smoke, air pollution, or high dust and chemical concentrations that you're breathing into your lungs in your work environment. All of these contribute to theoretical causes of emphysema. Currently it isn't known the specific causes of emphysema, but it is suggested that phagocytes, as we'll see on the next slide, actually contribute significantly. But overall, we know that the less surface that emphysema causes, less total surface area. So the evidence that we have for this idea of phagocytes is that they normally produce elastase, a chemical which really regulates the elasticity of the lungs and also the cell walls of the alveoli. If we look at smokers specifically, or generally anyone with an increased concentration of pollutants in their lungs, we can see that there's an increased amount of phagocytes, and these phagocytes are again producing elastase. So in trying to fight infections and tar buildup in your lungs, your body produces more elastase, and this results in more phagocytes to combat it, and then more elastase, which contributes to the alteration of your alveoli. However, as stated in the textbook, genetic factors also contribute. So this suggests that while smoking is significant and that anything that increases chemical concentration is significant, you can also be genetically predisposed to developing emphysema. Next, we can look at symptoms, and there's just a whole host of symptoms. If you can't breathe easily, many of these are also common in bronchitis as well. But we can see shortness of breath, having trouble getting air in and out of your lungs, chronic cough, lung infections, and this will result in wheezing, headaches if you're having trouble breathing. You also produce more mucus, more phlegm, and then you also develop a blueness on your lips or fingers, and that's because not enough oxygen is getting to them. Almost like you're holding your breath because of this disease. And then you can easily develop sleep disorders when you essentially choke yourself by constricting your windpipe as you lay down. You'll develop lightheadedness, anxiety, and fatigue. All of these just associated with not getting enough oxygen to your body. So when we talk about gas exchange and ventilation, this whole topic for this unit, why is emphysema so important? Emphysema is really important because it really demonstrates how alveoli function. When they become enlarged, destroyed, collapsed, stretched, or overinflated, they don't work as well. And that really shows off the important properties of alveoli. So this perfect size of having a really, really significant surface area to volume ratio. If they start to collapse, they lose the volume. If they become enlarged, they lose the ratio of surface area to volume. If they become stretched or overinflated, they lose their elasticity, um, because they're too thick to really expand and then contract. And also when they become too thick, they also let less gas flow, so they work poorly as a diffusion barrier. And this also suggests that alveoli have problems increasing or decreasing in size, which relates back to the diaphragm. If your diaphragm is working hard to make sure that your emphysemas expand, or your diaphragm needs to exert more force to make sure that your alveoli are expanding. And so this is why breathing is often forced in people who have emphysema. So this really shows how the whole pulmonary system is connected, simply based on this one disease. So treatments. Unfortunately, as I said before, the damage is irreversible. So what you're really treating is the symptoms. Your body can't repair damaged alveoli, which really demonstrates how significant and important it is to take care of them while you still have them. So don't smoke, kids. But there are common ways to treat it. You can clear out the mucus in your throat. There are also medical therapies, often drugs to relax and smooth the muscles along your windpipe so that more air can get through. There's an increased volume, and so that the passage to your lungs is essentially opened. The other therapy that they use to treat the symptoms is an oxygen therapy. If you've ever seen someone hooked up to an oxygen tank, it's because they need better, more pure air to get into their lungs. So they don't have to breathe as hard because the air that they're breathing has a higher concentration of oxygen. So while their alveoli may be less efficient, they are overall getting better quality of air to support this. So overall, I hope this presentation has showed really how terrible emphysema is and how important it is to take care of your lungs. If we're going to look at my sources really quickly, beginning I have my articles, my 2 articles. Next we have the textbook, the IB Bio textbook, and then we have 2 websites which contributed to the research. Thank you. This has been my presentation on emphysema.